Hello, folks. So, today we are talking to two charismatic personalities who have been working as heroes in our community. So, in my series of Salute the Heroes, we have Jharna Madan and Manisha Jain. They have been making masks for healthcare workers, for all the needy out there, volunteers that are working for others, providing services, food services. And as you know, with the CDC guidance that everybody should be wearing masks, the demand is never ending. And let's talk to them and see what they are doing and how they are doing it.
So, hi everyone. We are here today with our next series. In the series, the next episode of Salute to Heroes. So, we are saluting some of our community heroes. You know, the times nowadays, what is going on, the pandemic of coronavirus, and how we are all fighting against it. I don't want to say we are struggling against this, we are actually fighting against this as an individual, as a family, at an state level, and at a national level. And in this time, we have seen so many of our people emerge as our heroes. So today we have with us Jharna Madan and Manisha Jain. So they have taken this big, which became big, I guess, initiative of making masks for our, community, for healthcare workers, for community providers, volunteers, services, all the people, and with the CDC recommendation that everybody should wear a mask for protection, their own protection and others. It works both ways. So let's start talking to them without further ado. So hi guys, how are you doing?
Very well, thank you.
So you can introduce yourself. We'll start with Manisha.
My name is Manisha, and I live in Dover, Massachusetts with my husband. We have two adult daughters who are with us at the moment from New York and DC. I guess that's the only good thing that has come out of this situation.
Families together.
Families are together. I have been in the educational sector all my life here, all my 28 years that I've been here in Massachusetts. And just recently, I kind of retired from working in the schools and have been involved in the community.
Okay. By the way, you are very young. When you say retired, it doesn't look like you should be retiring.
Let's just say premature retirement.
Okay. And then Jharna, we all know you.
Hi, Tapasya. Thank you so much for having us on your show. We're truly indebted. Hi, everybody. My name is Jharna Madan. I live in Reading, Massachusetts, with my husband and my 11-year-old daughter. I've been part of the Indian community for the last so many years. It's a beautiful, vibrant Indian community. It's given us so much. I volunteer for ACL. I volunteer for Hindi Manch. I also help with TV Asia coverages in the area. So again, it's a pleasure to be here, and thank you, Tapasya.
All right. And then what you are doing, both of you, what you're doing around Few We Care, right? So how did that name came up and how did this idea come? Where was it generated first? Manisha, was that your mastermind?
Sure. So the idea, I would say, stemmed out of anxiety, believe it or not. When COVID-19 became real and really hit home, I started feeling very anxious, and I just needed something to do to, get a feeling of, okay, this is what I'm doing to help. And I came across this post for volunteers needed for sewing, and I started kind of following these on the hospital websites. And one of the hospitals had very detailed instructions on how to sew these masks, and they were looking for them. And I decided to sew a mask out of the fabric that I had. And when that was done, I kind of realized, okay, I can do this, but I cannot do it by myself. I need more fabric, I need helpers. And I posted it on Facebook. And the very next thing that happened was immediately Jharna contacted me saying, I want to help, what can I do? And the rest I'll let Jharna take on from there.
So I have a question. So the first one, you actually sewed, you have a sewing machine and you did it on your own?
Yes, I have a sewing machine for the past 26 years. That actually was my gift when I first was expecting my eldest daughter. My husband gave that as a gift. And I've used it a lot. And, I had it. And we all have some fabric lying around when we sew. So I had fabric and I followed the pattern. And but I said I needed more resources. I needed more fabric, more, people to help me out. And that's the kind of a post I posted on Facebook, saying, people, if you can come out and help me, I can sew a lot of masks per day.
And then what did you do, Jharna?
Well, as she said, as Manisha said, she was very restless. So was I. It was like, such a big pandemic had hit us, and I felt as if I need to do something. I'm not a healthcare worker. I saw her post. She requested for help in fabric. I picked up the phone. I called her. I said, I can order fabric for you. So I ordered the fabric, and then she's like, we need more help. There's a whole process that goes into sewing of the mask. It's procuring the fabric, cutting the fabric to particular sizes, ironing them. It's a lot of, there's a whole assembly line that's required. And
so where did you order the fabric from in the beginning?
So I ordered from Amazon. I shipped some to her. I shipped some to myself because we need 100% cotton fabric for these masks. So I just kind of took that initiative, just ordered it for myself.
And the two of you thought you will do all the sewing?
No, I don't sew, but I can cut and I can iron. So that's where
that's where the assembly line was born.
That's where the assembly line came in. And then it was Manisha's idea. And she said, she could put a video together with instructions and, the template of the two fabric sizes and how it needs to be ironed. So she was very kind. She put that video out there. We made a Facebook blast, and one by one, we feel so blessed and fortunate. This entire army of women started joining, and just everybody connected with that whole selfless, that we want to do something, we want to help, we want to give back. So, reaching out to Manisha, people were reaching out to me. We started with a WhatsApp group for 10, then it kind of just expanded, and now I think we have over 100 women that are. Sorry, go on, Manisha. You
have about 130 people involved in this operation, I would say. And Jharna is so right. All these people are just doing it so selflessly. And they just saw the video. They just saw Jharna. And that's what I said to Jharna. I said, I know people, but I don't know as many people as you do. So, she just made this whole thing go, I don't know what's the right word, go viral or whatever. And before we knew it, people just, as they say, log judte gaye, karma banta gaya.
Right, absolutely right. So the idea generated, and then she just gave it a big,
That's what. To answer your question about where we got fabric from, there are people, as Jharna said, and like she did, ordered from Amazon. I also posted in my town group about fabric donation. And from, I would say it's now almost 3.5 weeks, every day I get 1 to 2 bags of fabric donated at my
So
doorstep.
This is the fabric that's being donated. You guys didn't have to buy it after that initial, okay.
For the initial, we didn't have to, because any fabric was being ordered, it was taking time to come. But the very next day, I had fabric delivered to my doorstep. And then, Jharna created this whole WhatsApp group, and we started this assembly line where we, sent off the fabric to different people. They saw the video, they started cutting, they started ironing, and then sending it off to people who could sew. So out of these 130 people, I think about 30 of them are stitching. Rest are all, believe it or not, cutting, ironing, delivering, doing all kinds of things. And these are just 130 volunteers, but it's their entire families which are helping. So I would do 230 times 4. And it's pretty amazing.
It is amazing. It goes to show how humanity, how humans, however different we think we are from the outside, we are all the same inside. We all just want to do something. And this whole idea of a show generated because I wanted to do more. I saw people doing things out there which I couldn't. I couldn't be in the ER. I'm not an ER physician. So I said, I have to talk to people who are doing this. So let's see. So how did you connect to, so this is all curbside, right? When things come and things are getting dropped off at somebody's place, they're cutting it and they're dropping it off where it's getting sold. So who are these people who you have sent these masks off to? Like which hospitals, because I see a lot of thank yous going on Facebook.
Go ahead, Jharna. You want to answer that?
So obviously we have different hospitals, different doctors reaching out to us. So I think, Manisha will speak more about the types, the names of the hospitals, but we have about, Manisha, close to like 3,000 masks that have been made and delivered. And we have another 2,000 or 2,500 under production or that need to go out. So I'm going to have Manisha talk about the different hospitals that,
That's amazing.
So we started with Emerson Hospital in Concord. That's where this pattern was posted, and they were requesting. And then Metro West Framingham, Beth Israel, MGH, Beverly Hospital, Melrose, Norwood, Brockton, then several nursing homes, retirement homes, senior centers in the area, a lot of clinics, smaller clinics, home health care centers. So it's amazing. I mean, I think yesterday I sent a message in the group that the pleas that we are getting from these doctors and ER nurses, they are literally pleas for help. And it breaks my heart that, they're reaching out and saying, please, please, whatever you can do to help. So
because they don't have the equipment, because they,
yeah.
So are these reusable?
Yes, these are 100% cotton. They are reusable. They are mainly,
they can be sterilized.
Yes, they can be sterilized. They can be washed. They, by doctors and ER nurses, they are being used to extend the life of the N95 masks. So the doctors and nurses are getting one mask a day. And sometimes, at the end of the day, they turn it in and then they get it sterilized and get it again the next day. So they are using a cotton mask on top of their mask to extend its life. But then there's a lot of support staff, auxiliary staff, people who are not really on the front lines, but are still very involved. So they can definitely benefit from these.
That's amazing. So this 3,000 is, when did you start? What was your start date? It's been 2 weeks?
No, it's been more than 3 weeks, right?
3 weeks, yeah. Give or take 3 weeks, so.
Yeah, it's definitely been 3 weeks. I know that for sure. I would say March 23rd or so. I don't remember the date. It's
right, probably just after it started getting to a point where we said we needed the equipment. Yeah. So what is it that you need now? Are you having any difficulty getting the fabric, getting anything, or is it going smoothly at this point?
I think it's going. We have such a wonderful network of women, and it's so beautiful because one person posts something and there are 10 people who respond to it. Like somebody's machine got they stopped working. 5 of us jumped in and said, oh, you can take this machine, you can take that machine. The sewers need needles and threads and they're running out of that, but somehow it keeps coming. They keep generating it, and through our network. So we, through the donations of fabrics, because everybody can actually donate flat sheets, cotton sheets, as long as they're 100% cotton, we can use that for making masks. So I have taken out sheets out of my house. People are taking out sheets, delivering them. So there's a whole assembly line. So we have people just procuring fabric, having people who are just cutting, ironing, making the strips. And then obviously we want our sewers just to focus on what they're doing, because they're the ones that are sewing the mask at the end of the day. So I think on a daily basis, as Manisha said, she's getting fabric delivered. I am getting, requesting, how can I help? What can I do? So that's why we put a whole thing like, these are the things you can help. Procure fabric, deliver it, cut it, iron it. So it's actually, I think as a community, it's a very, very beautiful, generous community. They've supported us wholeheartedly. And I think we're extremely grateful and thankful to every single member of our group that's kind of gone out and helped us in this mission.
That's true. So how is the delivery? Once it's done, once it's made, you have volunteers to pick it up and then deliver it to the hospital where it's needed?
Yes, sure. So, we have certain hotspots, like Lexington is one of our hotspots. Dover is another. Jharna, North Reading is another. So wherever, depending on where the hospital or organization is, that's where we assimilate.
The closest, you will send it there.
Closest. And then we put out a request. And before we put out the request, people are like, I can come and pick it up and deliver, So it's just, it's amazing. One of our group members said it's Niswarth Seva, and that is kind of like the motto of our group, and that's also something which prompted our title. So I was talking to my daughters, so I kept calling it Group of Women, These Ladies, and my daughters were like, Mom, you need to give it a name. So we kept thinking, and a lot of names went through our minds, mask magicians, and I was like, no, we are doing it simply because we care. And then that's how So We Care, with a pun on the so.
Wow, nice. What day was the name born? Was it the third day, fourth day?
No, I would say
remember? Oh,
Very recently,
Yeah,
because there came a need where we needed to recognize it as a group, because it's not
right.
just one person, it's not just Manisha, it's not just me, it's a whole team of women, and we needed to give ourselves a name and identity, so that when there is an acknowledgement, it's the entire group that's acknowledged and not just an
That's
individual.
true.
So
That is so
so
true.
that kind of gave us the kind of that ownership in every single person, to pride in the fact that they're part of this group and they're doing some amazing work.
right.
That's true. And
Uh,
it's so rewarding for you guys to see, right, what you are doing. And then eventually, people don't even have to write a thank you. It's a great thing if they write, but it's just, giving that box. I think you guys feel that, you have done your part.
Absolutely. It's very,
Yeah.
very gratifying. And one more thing I would like to add is, you asked about where are we getting the fabric from. So but for one of our very big projects for a hospital, we have to make 500 masks. And there is this fabric company in North Carolina that donated all the fabric. So 60 yards of new fabric was shipped to my address. And I just dispatched it to 10 people who are almost done stitching these masks. So in about 2 to 3 days, we will be able to deliver these 500 masks. So,
That's amazing.
so
So this was somebody who reached out and asked you if you could do this?
yes. So someone in my town, I saw this post and they said, this company will give the fabric. Is anyone willing to sew? And, I talked to Jharna and we emailed with this person who is involved with the company, and it all worked out. So that I think was very, very generous. Spoonflower is the name of that fabric company. It's a
Okay.
very generous effort on their part to donate that much fabric. So they sent us
Yeah.
all the to make those masks.
That's amazing. So you guys are doing this amazing work, and is smiling through it, and such pretty ladies doing such pretty work. This is what the positive message when it goes out. In times like this, it just bolsters up. It says to us that the heart inside, and there are good people out there. When you reach out, more than you reach out for one, and 10 people reply. Right? That's what happened to you guys.
Yeah, you're absolutely right. Yeah, exactly. And I feel like this army that we've created today, the need is for sewing. Tomorrow, the need might be for something else, and we can
Right.
always count on this group. I mean, I can vouch for that. The way people have come forward, hats off to our community, and we are not the only group. I know there are so many people out there
That's
doing
true.
such
It's true.
amazing work, and everybody. So, crisis does bring out the best in people, I would say, and we're so
That's
thankful for that.
true. That's true. It's a test of humanity. And, you guys are doing amazing work. And, 6 months, a year later, you guys, the whole team will probably, sit back and go out for a drink and 130, all 130 or 200 of you. I can't imagine that gathering.
I think our hope is that this gets over. We all do, like as Manisha had offered, that we just do a potluck lunch, just meet everybody and give them a big, big hug and thank you. It's like that this thing, because it's absolutely gratifying. I mean, the messages we get and the smiles we see, it's so heartwarming, and we just feel so truly, truly blessed to be doing this.
Yeah,
And
you
I
guys, yes.
I
Yeah.
have to add, Tapasya, that Jharna knows a lot of these people. I don't think I know 90% of the people in this group. Personally, I've never met them. So,
Mm.
yes, for me, there is this urgent need in me that I need to see these people. And as Jharna said, give them a big hug. So waiting for all this to be over, though I'll feel as if I'm unemployed once all this is over, for sure. But and another very I would say something very moving that happened was one of my friends here in Dover itself, she passed this video on to someone else. Yeah, I
Mhm.
think another one of her friends in California, who passed it to someone in India, and they an NGO looked at it and they sourced fabric, they hired a tailor, and this tailor was able to make, because that's what he did day in and day out, earned a living through it and made 5,000 masks which were distributed in villages around Calcutta. So that kind of impact, really, I'm like, this is, if this could be done, then really everyone needs to come forward and do their bit, because you have no idea what kind of a wave it will create in the community and beyond.
It's true. So fight against this. We are all in it together. Like you have shown, you don't have to wait for something. You don't have to be somebody who's a ER worker, for instance. You guys are saving lives. That's what you truly are doing. And I'm honored to be talking to such, women. And I am so proud to be part of the community where such women, live. And I'm really grateful for you guys taking this time and talking to me. And keep up the good work. And hopefully we can spread it more and let more people see the positive message and the positive things that you have done.
Absolutely. And if anybody wants to connect with Manisha and me, we obviously are on Facebook. We have a Facebook group. It's so we care. So if anybody wants to reach out to join, help, absolutely, the more the merrier. And our hope is that obviously all of this does come to an end. I think that's the day we're waiting for, where life gets back to normal.
Yeah.
So Tapasya, thank you so much for having us. It's very, very honored to be on the show. So thank you so much for everything you and your team do.
My
Exactly.
pleasure. Thank you guys. Take
Thank
care.
you so
Stay
much.
safe.
Thank you so much.
Bye.
Bye.